What we're talking about today is Juvederm.
We're using Juvederm as one of the dermal fillers for the liquid facelift. There's a choice of fillers. I like Juvederm because of the smoothness of the gel, and the FDA approves the Juvederm to last a year, so people get a lot of bang for the buck with the Juvederm.
And you were telling me before we were on air that depending on what your specific needs are, one vial, I guess, could cover a large part of your whole face.
For young people like you and Robin here and Christy, one syringe will give us a lot. You'll see when we do just one part of the liquid facelift here on camera on Christy that she's going to use just a small part of the syringe just to get the one area done.
How often do you find people coming in to see you, though, when they think that perhaps they want to target, say, crow's feet? And then as they talk with you, they learn that there's more and more that they could do that they don't even see in the mirror.
Right. Yeah, that's one of the fun but challenging parts of the, of the industry, you know, talking to people like that. I really enjoyed it, education, but of course you don't want to point out things that people may not have seen.
Right.
I try to talk in terms of what's the value of a treatment. So typically with a liquid facelift, they came in for just a crow's feet, but they can use nasolabial folds, downturning corners of the mouth. If Juvederm would help that, then I call it bundling. In other words, get more than one service, then you save money. Just like you would with Comcast.
That's what I was thinking. I was going to call you AT&T. Right. All right, and you also said that a lot of women like this, and I guess men too, because it's a good trial if you want to try this before doing a permanent facelift. Right.
Well, typically most women won't go under the knife for a true facelift, but some would, on considering, and of course some would benefit from that. But a liquid facelift, either with me or any of the surgeons in town, prior to the surgical procedure, and going under general anesthesia and paying all that money, it'd be good to try that and see if they like the outcome. Even though it's temporary, that could be a good thing. A year later, you can then decide to do it again, a non-invasive way with injectables, or go under the knife and get a true facelift that will last indefinitely.
All right, it's not that we don't trust you, but let's let you show now what you're talking about. So you're going to go ahead and do this for Christy.
Well, right here, if you look at Christy, she's young, but she does have the beginning of the typical nasolabial folds we call the parentheses. So there's a shadowing effect there and there. As we inject in this area, we'll be able to get more light to bounce off. And youthfulness is all about light. The more light that bounces off your face, the younger you look.
Okay.
You can usually spot that from across the room.
All right.
Okay, the shadows tend to make us look older. And she has just the beginning, very slight, but you're starting to see the corners of her mouth go down. And a liquid facelift would essentially take that corner going down and give that. So the lips will start where it's pink and end where it's pink on the other side.
All right.
Instead of having that typical frown that starts in the 30s, and sometimes by the early 40s you can see it for sure.
Okay, so we're going to ice her. Is that what you're going to do?
Put a little ice on right over here.
Okay.
The needle is sharp and very, very tiny, so she won't feel like going through the skin. The gel, the Juvederm, is one of the smoothest ones. I like using it. It's the least painful, but it is thick, and there's be some discomfort for her that way, and the ice helps that, and she'll be fine with that.
Now, when you do this on our air this morning, will we really see it instantly?
We will. Depending on the lighting and the shadows, how we can actually demonstrate that by doing this to one side, we'll be able to compare to the other side, so we'll have a true before and after on Christy.
And you mentioned that this way two people can have this done and go back to work. They can do it on their lunch hour and go back to work.
Exactly. Many people go back the same afternoon, sure.
Okay. And also, if there's any stigma associated, which sometimes there is,
of course,
then you don't have to worry about explaining it to people. You just all of a sudden look better.
That's the big thing. The wonderful thing about the liquid facelift, whether it's Botox and Juvederm, is that you really don't have to explain to anyone. People will notice that you look great, but they won't know why.
Right.
And we go out of our way to make sure that things are done very naturally. I'm very conservative. The last thing you want to do is get busted.
Okay.
And that's part of the challenge.
While she's continuing to ice Christy, let me go ahead and show you what the deal is. Then we're going to come back and watch him do this on the air. But they're offering you this liquid facelift. First of all, if you don't know where affordable Botox is, they're on Gun Barrel Road between Starbucks and Chili's. Not more convenient than that, huh? There's their phone number and their web address as well. She's promised not to flinch.
So we're going to just relax. Good. Pull the skin tight here so she can feel the needle go in. But again, she's probably going to feel more from the gel as I inject.
You are so brave, Christy.
She's very brave. We'll do one more time, okay, Christy? And again, the gel is going to be very smooth. And we're going to see in just a few minutes, if not seconds, the difference between this side that we injected. You okay? Don't forget to breathe. And the other side, before and after. If Doug can catch that on with the lighting, I think the difference will start to show right away.
Well, I'll tell you what we're going to do. We're going to go to a commercial break. When we come back, we're going to show you what Christy looks like. We're back with the answer to what is it next on 3+U. Very good. Okay, here's the result. Okay, look, y'all, at Christy. She's not crying. And we're going to pull that tissue away.
That's right.
Can y'all see the difference on her face? And it's just been, what, less than 2 minutes?
Oh, yeah, and it happened right away. Just turn to look at that way. You see the shadow's gone here. Shadow's still there. We haven't done that side yet. She'll come back to the office. We'll get rid of that shadow there, as well as the rest of the liquid facelift. We'll get these corners pulled back up. And we got a few other treats for her we're going to do as part of the liquid facelift for Christy.
That is really amazing.
She's been so good.
And Robin said that it kind of hurts when you smile a little bit right at first, and that's why she's still kind of looking still.
Can you smile
Smiling
now?
on the inside.
Yeah, it's
on the
all
inside.
good.
There
It's
you
all
go.
good.
Well done. Thank you so much, Dr. Gesualdi. We're back
you.
with more
Nice
right
guy.
after this.